you've dealt with quite a number of people. People are coming into the hospital every single time.
I've also heard your stories.
Tissue and put it under
But
your
it's good,
pillow.
it's good. I've got the tooth fairy.
Hi everyone, you're welcome to the first episode of the Smile Code Pod with me, Noella. Now, a broken or missing tooth can happen in seconds. It can come from a football match, a fall, an accident, or an unexpected injury. Yet, what people fail to realize is what you do in those first few minutes can either save or lose that teeth. But when the teeth is lost, what happens next? You just leave the space, get a bridge, get a gap, get a replacement. What do you do? That's the question that a lot of people have on their minds. Now, today we're talking about dental emergencies, tooth replacement options, and why acting immediately in those first few seconds is very important. And of course, I have Dr. Asante here with me to help delve into the matter proper. But before we get into the conversation, let's take a listen to this.
Hi, EnamelLife. I don't really talk about this. I'm actually a bit nervous calling in. But I heard you guys discuss patient stories before, and I thought maybe someone else out there is going through something similar. So, about 8 months ago, I was in a situation with my wife that got violent. We'd been having serious problems for a while. One night it escalated and I was struck with an object. So I hit the floor and I lost a tooth upon impact. As a man, you don't really want to tell people what happened. So I never told my friends. I just told them I was in a car accident, which was a lie. I never went to a dentist. I never went to a hospital. I just dealt with it and focused on getting out of the situation. I've since separated and I'm in a better place mentally as of now. Thank you. But the tooth is still missing 8 months later and it's still affecting my confidence badly. I can't smile at work. I avoid certain conversations at work. I even cover my mouth when I want to even laugh with my friends. I'm ready to do something about it now. I just don't know what my options are, whether it's too late or what it's even going to cost me. Please advise.
That's a very interesting story. Dr. Asante, I'm sure you've dealt with quite a number of people. People are coming into the hospital every single time. Every single one has their own issue.
Yeah.
But based on the kind of people that you've met, you've interacted with, what are some of the most common ways? I mean, we heard about the domestic violence in the video, the sound recording that we just played. But what are some of the most common ways that people lose their teeth from their interactions?
Well, we as professionals really don't delve into personal issues. We are more interested in your story from a professional standpoint. So I want to know how you lost your tooth, whether it's trauma or it's perio. I explained that.
Okay.
Perio means that there was a problem with the support system of the tooth. That means that the gum became weak and then the tooth wriggled and then fell off on its own, became loose and then fell off on its own.
Okay.
Or it was an impact that caused the tooth to be dislodged from where it's supposed to be. So those are the real issues that we are looking at. But the general populace, of course, will have to tell their story.
Yeah.
And it's interesting because some of the cases you can tell they are from domestic violence cases, but the person is unable to express themselves because of the touchy nature of the subject. It is quite prevalent, I would say, and it's saddening as well that we have to live in a world where two people that claim to love themselves start inflicting harm on themselves. What I want to say to everybody in that kind of situation is that there's help for you. You don't need to stand up and face this alone.
Yeah.
There's the reason why avenues have been made. I know that especially when it comes to the societally acclaimed dominant gender, which is men, it's a bit embarrassing and it feels as if you are less of a man, but that is not the situation. I mean, in my experience, my little experience, domestic violence cases don't get better. So if your mindset is that it is a one-time thing or it's going to get better or that's not how it is, then you might have something coming, honestly.
I mean, I like that you made mention of the fact that the kind of society that we find ourselves in, because like you said, he's not able to even own up to his own friends
Right.
because of something like that.
So crazy.
And so I love the fact that when you come to the dentist, maybe Zoe Dental, Interchange Dental, when you come to spaces like that, you're not supposed to go into the details of the
Right.
story. We just want to know whether it's impact or it's
Yeah.
something that happened
Yeah.
that caused that. So we definitely love that. But that aside the domestic violence, the impacts, and also that, we know that, especially in football matches,
Yeah.
that kind of impact in there as well can cause you to lose your teeth. I mean,
Yeah.
we've seen people break their ankle, twist their legs, and all those things.
Right.
But we also know that, in there, some even wear mouth guards. How good or bad is wearing mouth guard? Does that also have an impact one way or the other?
Yes, mouth guards do have an impact, but they are uncomfortable. And it takes some getting used to. So you need to be somebody that you are used to it and you enjoy wearing it, or it's comfortable for you to wear it for you. Because you see, when you speak to professional athletes, especially, even the 1% difference, 1% makes a difference for them.
Yeah.
They look for the fine edges to get an edge over their opponent.
Yeah.
So I mean, if that is going to inhibit them, then they prefer to not wear. But mouth guard is going to protect your teeth. So it's just made of silicone where it absorbs basically the impact that is going to be felt on your teeth. But it's very common. I mean, sports is a contact. Most contact sports come with impact.
Yeah.
And impact can happen anywhere else in your body, whether it's your teeth, whether it's your head. And there are options for them. I mean, that's why footballers get paid a lot of money anyway. Yeah, because yeah, I mean, professional
lot is at
sports,
stake.
they are going to lose a lot
Actually.
if something goes wrong.
That's
So,
true.
yes, there are options for everyone. Accidents is common, but you see, the teeth is not thought of as the first point of call if somebody is in an impact, especially a road traffic accident, any kind of accident anyway. The teeth is not thought of. The focus is on saving the person's life, and then all other things are actually looked at. But there are critical things that we could do if the impact is not a life-threatening accident. There are critical things that we can do in order for the person to save the tooth. And time is really of importance, or it is critical in saving or losing the tooth during those periods. So yes, we do have a lot of cases like that. I'm really sad when something can be saved and then maybe the parents, usually it happens with kids because kids play a lot. The parent keeps the child at home for long, and then they come and then nothing much can be done with the tooth. I mean, just a normal consultation. Usually when there are trauma cases, the bulk of the treatment is consultation, taking radiographs, and then just observing the tooth. The bulk of it. I mean, if people knew that, they will probably come and seek the first opinion before anything happens.
I mean, since you've brought up the conversation of doing things in the first few minutes, I think we should just get into that.
Right.
In a space, in a coincidence or whatever, where you lose a teeth, what are some of the first few things that you can do?
Right. So there are different degrees of injuries anyway. So you could have just a fracture. So we have a complicated fracture and an uncomplicated fracture.
Okay.
So if you have an uncomplicated fracture, then that's pretty simple. With that, we'll have an assessment, and then we'll let the tooth, the inflammation around the tooth settle a bit, and then we can do a build-up for you, or like a composite for you. In a complicated fracture, complicated means that the tooth, the pulp of the tooth. So the pulp is where the blood vessels and then the nerves are exposed to the external environment, which is not supposed to be. And then the case becomes a bit complex. And then there are things that we need to do during that. But in the case where the tooth is totally avulsed, if I say the tooth is avulsed, it means that the tooth is out of the socket. It's totally out with the roots, and then the crown are totally out. Then it's very critical. You have a 1 hour time frame in order for us to re-implant the tooth, because the tooth we can put back the tooth.
Oh,
in those cases, yes. When the tooth comes out whole, within the first hour, if you're able to get to a dental clinic, it can be re-implanted into, and it's going to heal.
And after, if it's not, you're not able to get that within the first hour?
And if it goes beyond an hour, then everything is just a wishful thinking. Like we are just hoping.
Wow, I didn't know that.
Yeah. So, but it's also there are also critical things that you need to do with the tooth. You don't just carry the tooth in your hand. So, well,
Put it
saliva
under
is
your pillow.
no. So saliva is a very good medium to keep your tooth in, but I mean it's gross for most people. You can keep it in milk as well, or salty water. But salty water is very how do you call it? I don't like saying that a lot because the calculation needs to be right. Yes. So 1 teaspoon of salt in 500 ml of water, and then you can keep it in. Right. So 1 teaspoon of salt doesn't mean the rocky salt, because the rocky salt it's not what we are using for the calculation. It's that ridiculous salt that
It's
we
good
use
you made that clarity
Yes,
before people
yes,
start
yes,
doing
yes,
concoctions at home.
Yeah. So
Okay.
usually keep it in that medium. You bring it, or you can keep it in your cheek. You can rinse it under washing water, keep it in your cheek, and get to a clinic within an hour, and it can be reimplanted.
Keeping it in your cheek,
Cheek means that the saliva is around
So you
it.
just put it in
to keep
there.
it in there. So you know there are some tissues around the tooth that you want to keep alive. That's the reason why we are doing all this. So that helps the reimplanting of the tooth. Sometimes the tooth doesn't survive, and there are things that we could do as well. Yeah.
I see. So then
Dentistry is interesting.
it is very
It's
interesting. So many things that I'm getting to know today. But you know, like I said, the superstition.
Yeah.
When you're a child, you lose your teeth, you throw it on top of the ceiling, and then it will grow again.
The tooth
you know,
fairy.
tooth fairy tissue and put it under your
It's good. It's
pillow.
good.
you know.
I've got a few CDs from
any
Tooth
of-
Fairy.
Are any of those possible in any way?
A Tooth Fairy?
Yeah. Or the ceiling one.
Unless I'm the one coming to put
I
this
don't
thing there.
know. Maybe in your past life, you were a tooth fairy.
No,
Tell
but
us.
I mean, it's just folklore and
Yeah.
for kids to have a good imagination. You understand?
Okay.
Yeah, but yes, if you really want your tooth back, when we usually do extractions or you lose a tooth, we do ask if you want it back. We can give it to you back. But no, none of these things apply.
No,
You
that's
understand
sad.
me? Yeah.
Well, guys, none of this happened.
But for the kids, yes.
yeah,
The
I
tooth
was
fairy.
actually also going.
Yeah, the tooth fairy is very much.
You don't want
It's
to lose
very
your
much-
side gig. You know, but
you know.
for kids and for adults, what's the difference? Is it easier or more difficult when you're an adult getting your teeth back or growing it back, or some, like, you know, because we know children,
Yeah.
every single time you're either chipping your tooth, you're falling, is something happening. So
Right.
in those cases, you know, which is which? Is it easier as a child to get it back?
That's a good question. So the things that as humans, Homo sapiens, we have 2 sets of teeth, right?
Okay.
The first set is we know it as milk teeth or baby teeth, and then the second set is we call it, common term is adult teeth or your permanent dentition or your permanent teeth. After the age of 6, you start losing. So as early as 6 months, the child starts getting their baby teeth. It goes up to about 3 years, and then they become pretty stable for another 3 years. And around age 6, he or she starts losing the baby teeth, and then starts getting her adult teeth up until around 12, 13. After that, there's no other teeth that is going to be grown. But mind you, there are some studies going on in Japan and China trying to grow teeth out of a test tube. So we'll see.
Japan and China, I don't think they have 24 hours.
You know, it's improving. I mean, everything's improving, and we are finding ways to live longer, have better things for our bodies. So yeah. But yes, back to the conversation.
Yeah.
Aside that, there's no known tooth, no known natural way of producing or growing back a tooth after you've lost your permanent tooth. So the answer may be yes. It's easier for children to lose their teeth because they are going to have their adult teeth come
Anyways,
back.
yeah.
But for an adult, you don't get your teeth back again.
Yeah.
So you need a permanent replacement. The thing about children's teeth is that it's because of that. What I'm saying doesn't mean you should go extracting your child's teeth every time there is a problem.
Yeah.
Right? It's because there's a close or intimate relationship with of the baby teeth with the adult teeth,
Okay.
right? Such that the baby teeth acts as a guide for the adult teeth to come out. So if you take out the baby teeth too early, the adult teeth may struggle to come out,
find a
or
way.
yes. So a bone, there's no bone between them. So it's just a simple soft tissue that separates the adult teeth from the baby teeth. But when you take it out, then the bone forms over
Yeah.
the adult teeth. So it delays in coming. Sometimes it doesn't
Comes with the
come.
pain and all that.
Sometimes it's misarranged and you need to come and give me some dollars to do braces for you. That's how it is.
We like it. When you say this dollars matter.
No, it's not dollars.
It's not,
Cedis,
guys,
cedis,
guys,
please,
calm down,
cedis,
We'll address that
cedis,
issue. We know it's on a
cedis,
lot of people's
cedis.
hearts, but we'll address that as well. Okay, so now the teeth is lost from either a football match, an injury, an accident, whichever way. What are the options?
Right. So we have three main replacement types now.
Okay.
One is a removable type, and the other two are more permanent.
Okay.
I use the word more permanent because even for your natural teeth, things can happen to it
Yeah.
for you to lose it. So there's an element of care even when you get something permanent.
Okay.
So the first, of course, is a denture. So a denture is a removable implant. I think that's what we have on the screen.
Okay.
Denture takes its support from something we call the flange, the pinkish thing
that's what I was
around
saying
it.
earlier.
Yes.
Okay.
So that's what helps the teeth stay in place. This is available. I think there are some materials. You can get it in different materials, acrylic, Valplast. Don't worry, when you come to the clinic, we'll go into it.
Okay.
Yeah. So yes, this is a replacement option. It's very nice. It works. It's not for everybody. You have a choice to make. Some people, this is the only replacement option. This is pretty much universal. Everybody can get this.
Yeah. That's a denture.
Yes, for older people, we prescribe this more because of mobility. As you get older, you are not so mobile. For kids as well, we prescribe this because this is not a permanent thing and it accommodates growth of the jaw because the kid is still, or the child is still having their jaw and development. So you don't want to restrict anything with a permanent replacement. So at the extremes of both ages, this is a perfect or a great
Before we go
replacement.
to the next one, I'm very much interested in the kind of teeth or tooth that is used in this.
Really?
There's
Why-
a lot. I wanna
what do you think?
know. Yo, a lot of things are
Don't
going
worry, I've
on.
also heard your stories.
Dead people's
Hey,
teeth brought
you
back,
see?
manufacturers,
see?
concoctions put together to make a. Please.
Somebody said we've shaved their teeth to make a tooth for her.
Abio. So that
The
means
stories
I
I
do
don't.
like.
No,
Please.
they are all synthetic material,
Okay.
right?
That
They
are
made,
safe.
Yes, they are made from labs. They are made from scratch anyway, and then they are coated to look like the tooth and designed to look like the natural tooth. So
Okay.
they are all synthetic materials. There's no
Yeah.
you didn't use
No.
any dead person's tooth. Hey, dead.
Never know. So people will be keeping for.
I know.
But can it also be made to, some people naturally don't have white teeth.
Yeah.
So are there some that can fit the kind of teeth that you already have?
I mean, we always take your shade, that's what we call it, the
Okay.
color of your teeth
Yeah.
with you. So that you can choose
that as
so
well.
that closely matches with your tooth. Yeah.
Okay, so that's for the denture.
Yeah.
What other option do we
We
have?
do have the second one I'll talk about is a bridge.
Okay.
Right. With a bridge, we gain the support from the adjacent teeth, the teeth on both sides of the empty space.
Okay.
So because you can appreciate that when we put the missing tooth in there, it will fall off because nothing holds it in place. So with this, we reduce the size of the adjacent teeth so that we have
that's there and
other
there.
we have other caps, or we call them crowns, to go over them, and then we join it to the missing tooth in there. So that's a bridge.
Okay.
Also a pretty good replacement option. It's standard. It works for most people. If you don't want a permanent replacement that is non-surgical, this is your replacement of choice. Yeah.
Okay. That's nice. All these are again synthetic.
Yes.
Guys.
With the
yeah.
caveats.
Yeah,
That
very
caveat
important.
support.
All these are synthetic. Okay. So there's this and then there's also that. So what's the next one?
So the next one, yes, there's the last one. The last one is the implants, and the gold standard now. Yeah. So this closely mimics your natural teeth. As you can see there, you have the root system for all the natural teeth, and then the implant mimics the root system for your tooth. So it goes directly into your bone. Your bone fuses with the metal there, and then after the fusion is done, then the tooth goes on it. So this is actually like an X-ray view, but in your mouth you don't see any
All
of
of
this
these,
there. You
yeah.
just see the tooth there. Closely resembles it. We don't touch any of the other teeth. We just focus on the space there. It's the gold standard. I mean, it's the replacement of choice if cost and time and everything is not a factor. If you just tell me I should give you the best thing out there, this is what we have. It's not just in metal. There are other things. I mean, technology is improving. There are
Every
other
time.
materials that we use to fabricate the implant as well. But this is the most. Has the most extensive work done on. This is what research really backs. For now.
Okay, but is there does a type of implant go with a certain type of injury?
Yes and no, but that's very technical.
Okay.
I mean, that we don't even discuss
Yeah.
with patients. It's,
Okay.
it's for the practitioner to know exactly what they are doing. So we have different types of implants, right? Implants typically take 6 months because of reasons, because of fusion reasons, basically. But if you want an implant loaded on the same day, like a tooth on the same day,
Yeah.
it's also possible.
Okay.
But there are certain criteria you need to be able to fit in order for us to do that for you. You understand?
Okay.
But typically, it takes a 6 month period for us to get you, for us to finish with the implant because of good reason. Yeah.
Okay. So I mean, you've giving us an insight into the options that you have. So for whoever is facing the issue, all they have to do is come to the clinic and tell you, okay, this is what we have, and you're going to give them the options
Excellent.
that are there. But in the case where somebody is not ready, because let's be honest, all of these things have financial implications.
Of course.
If someone is not ready financially to get an implant, is there something they can do personally at home in the meantime to just make sure that they're safe and they're okay before maybe they can do some swing come in?
Hey.
Yeah.
I mean, so yes, all of them cost money. You can always get a cheaper. I always tell people you can always get a cheaper replacement choice, although it's not your first choice, and then scale up.
Yeah.
Right. You can always get something that fits your budget at the moment, and then, as she said, you can save up.
Yeah.
And then also there are a lot of treatment payment plans out there with different with our clinics.
Yeah.
And then you can do it. We can start the procedure for you, and then you pay as the time goes. So yes, losing a tooth affects your confidence. It affects the way you approach people. It affects a lot about you.
Yeah.
It affects your relationship with other people. I know a certain gentleman that's been wearing a denture for 21 years, and he's been married for 15 years. And guess what? He came to the clinic and said he can't go home without the denture because the wife doesn't know he wears a denture. Can you imagine?
You guys are doing a lot of surgery. Because that is not
Yeah.
I
I know.
What
So
I ordered versus what I got.
yeah.
I see.
So yes, it's a very critical thing for a lot of people. A lot of people actually have a lot of emotions attached to their teeth,
Yeah.
whether losing them, replacing them, and all that. So if you have an issue, just come to the clinic. If you've lost it, to come to the clinic. There are options for everybody. We can explain, we can talk about it, we can work out a financial plan. Just come. A consultation. I always say I can't overemphasize the importance of a consultation. It just puts your options out there. It makes you understand things better, because as Ghanaians, there are a lot of misconceptions out there. People say a lot of things without having any kind of mastery or control or knowledge about it. They just throw the information out there and people work with it.
That's true.
So you can just come and have a consultation. We'll have a nice chat. We'll explain your options, and you can have time to always come back and get what you want.
I see. Well, I think this is a perfect segue to, just bring down the curtains on this particular one. I was going to ask for advice, but you've definitely given that advice in that last statement that you gave us. So if there's something that we've known or learned from this episode, it is that a missing tooth can affect more than your smile. It affects your confidence, even your status in society can be affected by that. But what you need to know is that expert advice is always the best way to go. There's some more in our subsequent episodes, so please do make sure you stay tuned on Smile Code Pod with me, Noella.